We do not have any financial disclosures to make. Descemet stripping endothelialkeratoplasty is a commonly performed posteriorlamellar procedure. It is performed in conditions where the endothelium is affected due to some dystrophy, degeneration, or infection. While performing this surgery, the endothelium of the host is first scraped off and then a donor lenticule is transplanted. A frequently encountered problem both intra and post-operatively is decentered DSAEK lenticule. Coming to the challenges, the lenticule is kept in place by air inside the anterior chamber. Any manipulation can lead to collapse of the anterior chamber, which can further cause displacement of the lenticule. Authors suggest a simple makeshift Cobratip modification of a 30 gauge needle for tackling such situation. Coming to steps of creating this design, step 1 involves taking a 30 gauge needle, a needle holder to bend the tip slightly so as to get the cobra shape. You have to ensure that the bend is not blocking the opening of the needle. Also, we have to take care to ensure that the tip is not too long. As you can see, the bent tip resembles that of a cobra head. Now, step 2 involves bending the needle at 2/3 1/3 junction, making it an obtuse angle. Now attach the needle to an air-filled 1 ml syringe. Coming to the principle of action, the Cobratip helps in holding the lenticule. The angulation helps in proper movement. In case the air bubble moves out and the antechamber collapses, one can easily inject air inside the antechamber. Moving on to demonstration of usage. Here you can see that there is a decentered DSAEK lenticule. First, create a MVR entry. If you already have one, you can use that. Now enter the angled Cobratip from that wound, and then using the Cobratip, drag the lenticule from its edge. If the anterior chamber collapses, then one can inject air which is already inside the syringe. Now you can see that the lenticule is well centered and the anterior chamber is also formed. The most commonly employed technique for recentering a decentered DSAEK lenticule is external corneal massage. Authors have also described a Lomi massage technique which not only clears interface fluid but can also be utilized for recentering a decentered lenticule. Coming to the advantages of angled Cobratip over corneal massage. Corneal massage is an external procedure. It is less control. Time duration required is more. If anterior chamber collapses, then the massage has to be stopped and air has to be injected before the massaging starts again. The angled Cobratip, whereas offers an intraocular manipulation option, it is more control. Time duration for repositioning is less. And in case the anterior chamber collapses, air in the syringe can be pushed before repositioning again. Reverse Synopsis is another equipment which is frequently used for repositioning a DSAEK lenticule. However, there are certain differences. Reverse Synopsis has a large blunt tip. It is safer and can damage more endothelial cells. It has no lumen and cannot reform AC, whereas angled Cobratip has a sharp small tip which offers a firmer grip with less cell damage. It has a 30 gauge lumen, using which one can also inject air in the anterior chamber. Moving to possible complications difficulties, the needle has to be bent carefully. If not done, then the surgeon will face difficulty manipulating the movements. In less trained hands, there is also a possibility of endothelial damage. The angled Cobratip lenticule repositioner is a simple frugal modification of a 30 gauge needle which can be useful in repositioning a decentered DSAEK lenticule.